First, I want to just do some thank yous. I want to thank Simmons. Simmons graciously let us meet in this building. It's a great building, has AV, so thank you, Greg. Greg's running around back there. Thank him for that. They did this totally just as a community service to us, and we appreciate it. I also want to just kind of clarify from the get-go. We are going to start a new practice. I know half of you guys, but the other half, I'm Dan Weeden. This is Joel Fankhauser. We're going to be in partnership. We are leaving Mercy, okay, just to get that straight. We are not going to be Mercy employees. We're not going to be part of Mercy. Mercy we've been talking to them about this for the last year and a half. They know we're meeting tonight. This is not a clandestine meeting, okay? And just to kind of set the record straight, and also, I mean, we've put a ton of effort in the Mercy Epic system, and we will have access at some degree to that record. So our patients will not have to be transferring their records to us. We will have access to that. So that's just to kind of get us up and going. All right, we're going to tag team here.
We're going to tag team to keep you guys entertained. I'll sing, he'll dance. Just a reminder, Dr. Weeden, he's a graduate from OU. He's been in practice here for
20.
More years than I've been alive, let's say that.
20.
20, oh, 20,
No,
20.
not that long.
Oh, I'm just kidding, 20 years. And I've been here for 4 years. We've both been in the same clinic, the Garrett Goss Clinic, for the last 4 years. So a lot of folks want to know, why are we doing what we're doing? And so here's just a brief sort of facetious example of what we're doing. There on your right is sort of the way the normal system works. You come in with a shark and you have to go through this whole big spiel. And then on your left is how it should work. And more seriously, here this graph on your right, you guys don't need to know all the details of this graph, but what you do need to know is that that very sharp line going up is the average cost of healthcare and the average cost that a employee pays out of their pocket. And that bottom lighter blue line on the bottom is the average income increase over that same time period. And so while healthcare costs have essentially doubled since 2000 for the average family, income's only gone up about, 18-20%, somewhere in that range. This is not a sustainable path that we are on. Very specifically, the average family of 4 now has insurance costs of about $16,000 a year, depending on with the out-of-pocket and subsidies from their employer. So if you don't have a good subsidy from an employer, that's no longer an affordable option for us.
Okay. So, excuse me. So what we are doing is called direct primary care, okay? It's in a way, it's very simple. We're going to provide care, and we can go into details of, and it's on our website, of what all that care involves, but it's going to be care that we're not going to file insurance for, and it's going to be just a monthly fee, okay? That's the gist of it. You know, it's different for everybody depending on your insurance, okay? Now, the premise is that with third-party payers, with Medicare, with insurance, it has driven medical care, and where they're headed with us from primary care standpoint is that we're going to have to take care of more and more people, have fewer and fewer, less and less time in each appointment, okay? And the future is really looking like that I would be a quarterback and I would have 2 or 3 nurse practitioners, and I would only see very sick people, okay? And I'll just be very honest with you, that's not the way I want to end my career. I enjoy taking care of kids all the way up through adult. I enjoy taking care of grandma and babies. I just enjoy knowing families, caring for families. Having the time to minister to families is extremely important to me. And so I want to say, yes, for some of you in this room, this is going to cost more, but I also want to say that we're going to provide a different level of care. When Joel and I cannot see somebody the same day or the next day, we're going to stop taking new patients. I mean, we don't know exactly what that cap is. They would say nationally it's about 500 to 600 patients apiece. We currently have about 2,300 patients apiece, okay? So it's going to look a lot different. This is not going to be for everybody. I mean, I realize there's some people that this is not going to work for, but that's kind of the gist of what we're going to be doing. So here we have, how does it work? It's pretty darn simple. If you've seen on our website, birth to 25, $30. This is by ages, 26, 64, $60 a month, 65 plus, $80 a month. So you will understand for our Medicare folks, okay, and this is really the hardest part for me because it's a harder sell for Medicare. I can talk to the younger people and show you the economics, and Joel's going to show you some of that. It really makes sense. But for people 65 and above, it's just going to cost more, okay? Now, I would tell you I'm going to give you better care, okay, but there's no ifs, ands, and buts. It's going to be a monthly fee, and we can talk more about that in the question and answer session. We are trying to incentivize taking care of families, and you'll see $150 a month for the whole family. Single parent family is a parent and all their children, if it's a single mom and has all their children. So we're trying to incentivize that. Okay. All right, is this just concierge medicine? And you'll hear that term. I really don't like that term, okay? Mainly because it really implies that we're just taking care of the wealthy. And I really don't feel, how we came up with that price range is we looked at what is the absolute minimum we can charge and make a living. I mean, and we're not going at this to make more money. We're going at this to practice better medicine. And so that's really our driver. Concierge medicine would just say you just take a added fee, they still file insurance, they haven't cut their overhead at all, they just take care of fewer people. And as you get to learn what we're doing, this is quite different.
So we won't go through boring math with all of you guys, and we'd be more than willing if you'd like to individually sort of discuss these. This is very specifically the 2014 Walmart plan, the prices that I had available to me for the options that existed for the typical Walmart employee. On the very far right of the screen, the DCC NWA, that's us, Direct Care Clinic of Northwest Arkansas, that includes both enrolling for the HSA and paying our monthly fee. But because there are no visit costs associated with that, you can see we're actually essentially competitive with their HSA and HRA and have a substantially lower yearly cost than their higher HRA. And again, same for the public schools. For us on the far end is including their bronze plan along with us, because we encourage people to have some form of insurance. If you end up with a very serious illness, this model does not cover if you need chemotherapy. It does not cover if you end up in the ICU for 2 weeks, right? This is to provide primary care. So you need to have some form of insurance. This is pricing their insurance along with what we do. And again, very, very competitive with them. And that's assuming that you get none of the visit costs reimbursed through your insurance if you make that effort. And so the next question is, we've had a lot of questions, people asking about labs, and so we posted some of the very commonly labs done. And on the left are the labs, the cost that you would be charged through a typical clinic. These are actually the costs at our clinic. And that's the pre-insurance cost. It's virtually impossible to figure out what someone's post-insurance costs are going to be till after you get the bill. On the right are our costs. These are the costs that Quest Labs has given us. You can see that's a fairly substantial difference. This is obviously a good plan if you have insurance that has a very high deductible, or if you have no insurance at all, because you're paying about 1/10 of the price for the same labs.
This thing.
Now we'd like to talk about why you guys would join us. I grew up reading Calvin and Hobbes. I love Calvin and Hobbes. I think they have something to say about everything. I'm ending with this and why you should join us, because Calvin and Hobbes, they're in the forest. They're getting ready to explore, and everything. They've been in this forest thousands of times if you've ever read Calvin and Hobbes, but everything looks new to them now. They're ready to explore a new world. Dan and I are ready to explore a new world with you guys of what healthcare could and should look like in America. And we feel like our model is going to allow us to do things that the traditional model doesn't. It's going to allow us to spend more time with you. It's going to allow us to know you better. It's going to allow us to provide care in ways that you couldn't normally do it. We're going to average about 30-minute appointment times. We're going to average about a third as many patients in a day as the typical clinic does. We're going to average about a quarter as many patients, give or take. And all of that for a price that's competitive with what the traditional office is offering. I think that's a good deal for folks. I hope you guys do too.
Before we open it up for questions, I do want to just say a few things and just kind of reiterate. Joel said, this is not insurance, okay? This is not insurance. You have to have catastrophic insurance. But I tell you, I'll be honest, I think that catastrophic insurance is what insurance is. It insures something you can't pay for, okay? And primary care, I tell people over and over again in my office, primary care has evolved into we're insuring like you would insure your car to put oil in it, okay? It just doesn't make a lot of sense. What we do in our office is not that expensive. You need insurance when you go to the hospital. So that's the first point. The other thing is just to kind of set the record straight from a standpoint of what Joel and I are offering. We, like on our website, one of us will be available by phone 24/7, okay? We are going to keep regular office hours. We do not have a location yet. I can tell you it's going to be in Rogers or Bentonville. We're looking at a couple different spots, okay? We will have one nurse. Currently, between the two of us, we have 8 employees for 2 doctors. That's what healthcare has evolved to, okay? And so it will look a lot different. When you call, we went and visited a clinic up in Wichita, and when you call, you're just as likely to talk to a doctor as the nurse, okay? It's going to look totally different, okay? So just to say that, we can talk more specifically about different parts of it, but anything else you want to say? Just open it up.
I think it's best. What our plan is for weekends and holidays is, again, you'll always be able to reach one of us by phone 24 hours a day. Most of the things that come up on a weekend or holiday, you don't actually have to be seen for a good number of the urgent care issues that arise. One of the reasons that you get called into offices is because doctors' offices don't get paid unless you walk through the door. And if we're on call for, right now, there's probably something between 15 to 18,000 people that our group is on call for on any given night. If I get called by one of 15,000 people, I don't know who they are. I don't know what their health is like. I can't answer a single question about how they are health-wise in the world. And so I have to defer to what would be the thing least likely to get them in trouble with their health and least likely to come back to me as a problem. And that's always, oh, you have to go somewhere, right? That's why healthcare is the way it is, because we don't get paid and we don't know the people that we're trying to help after hours. We don't have right now, we're going to be open Saturdays and Sundays after hours, but most of the time that doesn't really need to happen. A lot of the times that can be addressed with phone calls if we know who you are.
And I guess the only thing to add to that is that, we aren't going to be open on the weekend. Joel has little kids. I've got my wife, and we're not going to work 7 days a week, okay? If we have 3-4 years from now have 2 or 3 other doctors joining us, which hopefully we will, then would we do extended hours? The 2 of us are not going to be doing weekend and extended office hours. We'll always be available by phone. And we did. Good question. The question is, can you use HSA, that's health savings account money? These are words that just get thrown around like IRA and everything, just to tell people, and I know most of you all know what that is. Health savings account is essentially, Simmons Bank does it, $3 a month. The people that can't do it, Medicare, and people that already have a flex spending account with their employer or another HSA. But an HSA, you put money in it and you can pay your medical expenses tax-free, okay? Just to tell you what that is. In answer to your question, Randy, it is, right now, technically, no. You cannot do the monthly fee from your HSA. But what you can do is when you come to our office and we see you for a physical, really for anything, we can give you a receipt that you were there, and on that bill is the standard charge. Now you're paying for by the monthly fee, so you're not going to be paying us, but you come in for a physical, we can charge you the standard charge for a physical. I mean, that would be on the sheet with a day of service, our name, our provider number. We can give that to you, and yes, you can take that out of your HSA. It seems like a game, and it kind of is. They are trying right now. There's a coalition, direct primary care coalition, that is trying to get that law changed so you could, but technically you can't just automatically withdraw it and pay for it from your HSA. But when you start doing the math and you get seen and you get appointment or...
I was going to ask, why don't you tell them how much a typical physical gets billed for so they figure out
Yeah,
how
a typical physical would be anywhere from $150 to $200. That would be a standard charge. Wellness for a child is $125 for like a 6-month-old visit. And then you've got immunizations on top of that, okay? So, we'll address that in just a little bit. But the health savings account, you can take money for our services out of there, but it has to be done with a day of service. Does that make sense? Am I okay? I think health savings accounts are tremendous. We have a flex spending account that is you lose it by the end of the year. It's not worth near as much. Health savings account you can roll from year to year. It's a great deal. I mean, it's if you can have one, you ought to.
So the question was, can you turn in a bill to Medicare or Humana? The answer to that question right now is no, you cannot. Not for anything we do in our office. If we need to order a test that's done outside of our office, if you need any form of imaging done, if you need labs done, they can bill your insurance directly. But for things done in our office for Medicare right now, no, you cannot. Medicare is not very flexible on that at this point in time. Yeah. So the question was, if you've met your deductible, if you can bill that to your insurance, is that right? After you've met that deductible.
And then we have just a regular appointment with Dr. Weeden.
It is my understanding that yes, you can do that. If we are an out-of-network provider at that point, you want to double check with how much they're going to reimburse, because there are some places that have less reimbursement and some that have substantially less reimbursement for an out-of-network provider. So you would like to check with that if that's important to you before you make that decision. Repeat the question.
The question, would we be a part of any network? It's kind of interesting because John Furlow is an internist down in Fayetteville, and he has done this type of practice for last year, been very successful. He's kind of nurtured us along. And in talking to John, the big networks didn't even realize he was gone for a while. Okay, I mean, so there is a little lag time, but I will tell you, probably now he's saying everybody realizes he's not in network. We are counting on, when you look at your insurance, count on us not being in network. And I'll tell you, it's extremely variable, and if there are folks in here with small children, immunizations, just to tell you briefly, we are totally committed as pediatricians that we have to give immunizations. We feel like that's the most important thing in pediatrics to do, okay? So it's going to be a difficult thing, but we are working hard at how to do immunizations. One thing that's interesting, the Affordable Care Act has mandated wellness, okay? So it is covered, and it's covered by private insurance at a different degree. And so you really need to look at what your insurance has. Like, for instance, I know Walmart covers wellness for an out-of-network provider at 50%, okay? But you need to think of this a little bit differently. So you come in our office with a 6-month-old, and I immunize your 6-month-old. Your fee to me has been covered by your monthly fee. But I give you a charge that'll be $125 counted for wellness, but also immunizations, which are expensive. We are not making money on immunizations. We will charge for immunizations cost plus probably 10%, okay? But you will receive a bill that day when you're in the office. You will be drafted for the immunization, okay? Just that part of it. But that whole bill can be filed with Walmart for wellness, which will pay half of it, and you can take the rest of that anything they don't pay and take it out of your HSA. Now, but I will tell you, I have a patient that works for another bank, and they cover nothing for out-of-network wellness, out-of-network providers for wellness. But when I quizzed her, they do pay for immunizations, okay? So that immunizations are a big deal. We realize there's a cost to them. We're going to do everything we can to keep our costs down, but we can't afford to just immunizations will not be a part of our monthly fee. You need to realize that. And
We are working on a better long-term plan for immunizations, so we can work that out. We don't
Yeah.
we don't have one set in stone that we're willing to commit to today, because we realize that is a stressor for families, and so we're working out a better way to make that happen long-term. We'll keep you guys updated via our website when that gets more set in stone. His question was, will the long-term plan for immunizations be before January? Yes, that's the goal. This transition happened a little bit faster than we were wanting to because of changes within Mercy and new contracts, and so we're kind of having to speed everything up faster than what we were originally hoping on doing, and so we're trying to get everything done about 6 months faster than we thought we had to. But yes, well, our goal is to have that in place before January, before anybody needs to make a decision. What happens in most clinics nowadays is the wholesale rate and the insurance billing rate are not really particularly related to one another. Now, the rate that the insurance company reimburses at might actually be more related to the wholesale rate, and the way clinics get paid for immunizations now is only loosely related to how they're billed in the first place. And so, yeah, well, a clinic can bill Blue Cross $1 bajillion for an immunization if they wanted to, but they're not going to get paid that much. They're going to get paid whatever Blue Cross is willing to pay. Again, one of our goals in this process is to find a smoother way to do this, and while not ideal, one way to avoid having to deal that all together is, or you can, if you so desired, if it was easier, until that gets set in stone, the health department can do immunizations for all kids regardless of insurance status, if you like the model otherwise and just are concerned about immunizations.
I mean, and just to tell you, if your insurance does not cover immunizations, we can give you free. I mean, it's kind of a crazy thing. Okay, people with no insurance, I can give free immunization from the state to. I shudder to say this, but I actually kind of wish that the state would take over immunizations of children. And actually, I think it's in Vermont, they do. Nobody pays for any immunizations. I kind of wish that was the way it is, but it's not. It's not in Arkansas. So if you have insurance that covers immunizations, I can't give you vaccine for children vaccines. So, other questions? To ask the question, if you have other equipment at home, nebulizers, oxygen, are we going to be able to write for that? My initial answer is absolutely. As your primary care doctor, we can. Now, the only caveat would be if your insurance had a stipulation that you had to be an in-network network provider to do that, to have somebody. Right, I mean, like for instance, like we're not going to participate in the Medicaid program, so I can't sign for a Medicaid person. I can't sign as their PCP because I can't be their PCP. And actually, with Medicaid, they won't even let us. We have some handicapped adults with Medicaid that I've tried to say, how can I take care of them? They won't let us. We can't waive the fee. We can't take care of them for free, and still because they have to have somebody that's participating in Medicaid to sign their stuff. My answer to you would be, I think that we, as providers, carrying license, we should be able to sign anything medical-wise, because I really want to reiterate, anything we would normally do today in our clinic, order an MRI, order home health, we can still do that. Your insurance will still pay the same. We're only talking about what our fee is in the clinic. That's what the monthly fee will cover.
The vast majority of insurance plans available in Northwest Arkansas will allow us to do that. The only ones that definitively won't are Medicaid and TRICARE, which are both government plans. The question was, if we sign up for a monthly fee, what's the term of the contract and when can the prices change? The term of the contract is 1 month. If you don't like us after a month, you can leave. That's okay. We'd hope you don't. You seem like a nice guy. but the term of the contract is a month. The prices, in theory, could change in the state of Arkansas every month. We wouldn't do that. Most states have enacted laws that say you can change them once every 12 months. We would make that our absolute minimum, personally. That's not written in the contract because the contract is a 30-day contract, but hopefully you know Dr. Weeden well enough to know he's an honest guy and that he's not going to get you to sign something and then 2 weeks later send you a surprise bill. The question was, how are we going to ensure our patients pay us? We'd prefer an automated draft. Not everybody's going to feel comfortable with that, but that would be what we would prefer. It makes life a lot easier for everybody. You can pay if needed. We can work out deals with the credit card billing and things of that sort, but the preferable method would be automatic draft.
Take care of everything that we would need.
Well, we're still going to be primary care. I mean, if we need a specialist, Joel and I mean, we both use Mercy. I think Mercy is the preferred hospital from my standpoint. The physicians that I know, specialists, the surgeons, the ENTs, the orthopedists in our area, I will still refer to the same people, and those pretty much are with Mercy. So that I do not see that changing. I will tell you that one of the things, and this is an interesting, as primary care doctors have to see more and more people, and they get the metrics, or the evaluation for doctors is patient satisfaction. The number of referrals goes skyrocketing, and the number of pain medicines goes skyrocketing. And so it's just not good medicine. And I've seen it myself when I'm really busy and I don't have something, I can't spend the time, that we refer quicker. So I feel like my referrals will go down. I absolutely will refer to people if I think they need it. And if we will refer pretty much in the Mercy system, though there are some doctors that aren't in the Mercy system. We are not bound to the Mercy system, but that's what we've used and we feel comfortable with them.
So Juan's question was if we will need a second primary care doctor, to reiterate hers. No, you will not need a second primary care doctor. Ah, there we go. Ah, look at me. Yeah, it only took me the whole meeting. The question was, will we need a second primary care doctor? No, you will not need a second primary care doctor. Most of the folks that we would refer you to in our current clinic are not other primary care doctors. They're specialists. They're people who have done a training above and beyond or different than what we currently do. If you or your child needed a specialist above or beyond or different than what we currently do, then yes, we would obviously refer you to that physician, but not for a second primary care provider.
The question is, what do this lady's, their mother is very accent prone, if their kids need stitches, they need x-rays. Good question. From an insurance standpoint, your insurance is going to pay for an x-ray just like if I ordered it in the clinic today. I mean, that's not going to be any different from an insurance standpoint. Now, where will we do the x-rays? That will probably be a little bit different, and we might use we will still have access to Mercy to be able to use Mercy facilities. They've got x-ray at Mercy Health Center. But if people don't have, I mean, some of our folks have a high deductible plan, which is kind of what we fit in with, and so they're paying out of pocket for the first $6,000. So we're going to talk to Open MRI, and and some of these facilities, and you can get an MRI scan for a whole bunch cheaper than the insurance rate at a hospital. So some of that will vary. Now, when it comes to things, if we are open during the day with things like stitches, that type of thing, we will do that in our clinic. Anything we're doing now, pretty much we would do in our clinic. So if things are broken and or need to be sewn up, we will do that. Our business model is we're making our living based on the monthly fee. So we are not going to charge an exorbitant ER rate when you come in and get stitches. All you will really be charged, because we really feel like you've already bought our time. You've paid for our time, okay? That you'll be charged a much smaller fee just to cover our physical costs of the equipment we use and things like that, because we have to have supplies. So it's not going to be a big charge, but you will get a charge. I mean, just to tell you, if we sew up a cut, there will be a charge. We have not sat down and said what all those charges is, because I tell you, right now we don't know where we're getting the equipment yet to do that. So this is evolving. We do know what the monthly rate is, and that's the bulk of what we're going to be charging.
Most of the physical supplies for procedures like that are $20 or less. We're not talking about a substantial amount of money for that.
Yeah.
The question was, what happens if you have to go to the emergency room? If they'll contact us as your primary doctor and let us know. I would encourage you that if you're not sure that they have contacted us, for you to tell them to contact us, and if they haven't, you or your family can contact us directly. We want to know, and we would like to know, unless it's very clearly, obviously an emergency, we'd like for you to talk to us beforehand so we can help you decide if it really is an emergency. Lots of folks think they have an emergency because they've been told for so many years, go to the emergency room for that. And it's not really an emergency. It's a doctor's office trying to make sure that they have less liability attached to themselves.
Okay, the question is, if you're in the hospital, who will take care of you? Well, my patients know, I currently don't take care of adults in the hospital. I use the hospitalist service, okay? And when we start this new practice, we will both be using the hospitalist service, and there's going to be a new pediatric service for pediatrics. We are not going to go to the hospital. We don't feel like we can adequately cover both, okay? So we are just going to be doing outpatient medicine. We will have access through Epic if people go to the emergency room over at Mercy. Okay, we will be able to see that if you go to the emergency room, or if you're admitted. And I think this is kind of your question. If you're admitted to Mercy Hospital, we will be able to see that record. Okay. Now, will it be currently, with the way we're activated with Epic, literally you sneeze and I see it. It comes through my in-basket, everything that's ever done. It will probably be a little bit more limited, but if we know that you are in the hospital, we definitely would be able to access that at Mercy, if that helps you. But we are not going to do inpatient care, just so everybody we are not going to be doing inpatient care.
Matt, this is actually going to be the same for just about every doctor's office nowadays. The pediatric groups have just recently started creating a pediatric hospitalist program. The adults already do have a hospitalist program, so this is not unique to our clinic. This is the nature of healthcare in America now, and one that we can't change.
I'd just like to say something.
Yes, ma'am. So the maximum for a dependent child is 25. If you're between the ages of 18 and 25 and your parents aren't joining us, then that individual can sign up on their own. But if a parent is joining, they can sign up a child up to the age of 25.
Yeah. Just to wrap things up, and I really appreciate you all coming. We do feel like, I feel like for kind of an old dog that's done medicine, I've got new passion, and I really, there's parts of medicine I really enjoy, and I think this is going to allow us to enjoy that. But we don't know this is new territory. So if something really doesn't jive with you, please tell us, contact us. We would love to hear about what your conversation with insurance is over immunizations. We're gathering data there. We're trying to make a better path. So any feedback you guys can give us, we greatly appreciate. For our kind of so really what's the next step, okay? We are reserving spaces. On our website is a place, a button, save a spot, okay? Now, my mother thinks that I'm just going to be so over flooded with patients, because she's my biggest fan, that I'm going to have to turn people away. I realize that that hasn't happened in any other direct primary care, but we are going to take first come, first serve, and really what we're asking, if you want to do this with us, and we know the fee, if you got any questions, email us. If you would fill out, if you would register on there for Save a Spot, your name will be put on a list. Where it goes from there is we will be contacting you. To sign up does not mean you are signing on the bottom line. We're going to start drafting your account by any means. We are not going to take anybody into our practice that we haven't had a sit-down, face-to-face conversation with, okay? So that they know exactly what we cover, exactly where things stand, how the draft's going to work, everything like that, mainly to protect us. We're not going to let people sign up online because every drug seeker would come see us. And so we're not doing that, okay? But we're also not going to make you sign that you're going to have to stay with us for a year. I mean, and kind of what Juan, to bounce off what Juan is saying, I would much rather than being graded on a survey that they call you and make you answer 10 or 15 questions about my care, that if we don't take good care of you, you need to go somewhere else. I mean, to me, that's how we need to work. I mean, I want to win your ability to take good care of you. If we're not doing it and we can change something, we want to hear from you. But for those that don't want to sign up online or register to Save a Spot, there are, back there on the back, there's 3 clipboards that have a form that you can sign up, put an email address, put your phone number. If you're sure after tonight you want to register, which means you're going to get a call saying, okay, we've got an appointment to sit down with you 10 o'clock next week, and making an appointment to sign up with us, that's what the registering is about, okay? When we actually start doing those appointments, we're not quite sure. I mean, that's going to be something we're going to have to discuss with Mercy. We probably will start that in December sometime, okay? But our doors won't be open till January. We really strongly encourage you guys to connect on our website, because we will let you know where we're going to be. We'll let you know any information we've got with different insurance companies. That's the way we're going to communicate, okay? So thank you all for coming. And on that sheet, if you want to register or if you don't want to register, that on the bottom of that sheet is specific questions you have for us. We would love for you to write those. If we haven't answered something, you have a question, we would like for you to write it down there, okay? Thank you all.